The ventilation and perfusion basically means is the amount of air, okay, that is amount of air and blood that is actually participating in gas exchange, okay? And in that case, what happens is that you get a ratio, and ratio doesn't have a number. So remember, what is my cardiac output? And usually you say there's a V for this ventilation and there's a Q for the perfusions, right? And usually what happens is that what is my normal, like your amount of air that you're getting into your lungs, right? Usually about what? Usually it's about what? It's about, okay, let's just write down here. About, okay, if it's a normal lungs, you get about what? Like 40 to 100 ml of the air, right? That's what you get. And then you get, what is the cardiac output? Q means what we're talking about, the blood flow. And usually about that is what? 5 liters per minute, or you say 5,000, right? Millimeters of mercury, ml per minute, like millimeters of mercury and all that, ml per minute, right? You have to know that too. And in that case, what does that get? All this get cancels out, and you should be able to get, if it's 4,000 and 5,000, you get like probably 0.84 or something, but anything that's 0.8, let's write down this. This is the ratio, okay, that you get to see. And we say that it's a normal ratio, okay? And this is a normal ratio, okay? So in this ratio, the blood is actually going to continuous flow, okay? That's what we say. But if you look at this right here on the up-axis, what is happening here is that, okay, there's no blood flow, or we say, remember, there's ventilation but less perfusion, so let's just write VQ. So you have like a lot of ventilation right here, because remember, a lot of air is there, right? A lot of air is there, okay, but maybe less perfusion is there, okay? That means what's going to happen is that some of the air is going to get wasted, right? So in that case, let's just say, okay, so in that case, if you do the number, I think they say something like, okay, in the OPEX, you have the volume, which could be because, which is going to be probably, I don't know, like 0.25 or something, okay? That's going to be my amount of air. And divided by, okay, that's going to be 0.07, and that should be able to give what? Like 3.6, something like that, okay? This is my ratio. And this VQ is like, look, anything like that is greater than 0.80, okay? Or then we say that, okay, there is the VQ is what? We say this is, we get a higher 3.6, right? So now, this tells me that there's a higher VQ ratio. Let's just write this a higher VQ ratio, okay? That's what it tells me. Now, if you say that now, this is a base right here. If we look at the base, or is the VQ here, we also have to look at the numbers now. So in these numbers, let's just quickly think of the numbers. That's going to be 0.8, okay? About like 1.3 or something like that. And that gives me about like 0.60. Okay, in this case, what happens, my VQ is lower VQ. Okay? Lower VQ. Now, lower VQ. So, but this is physiological, okay? This is normal, okay? And that happens. So this is not pathological, okay? The normal VQ. But these are not shunt, these are not dead space, okay? These are called VQ mismatch, okay? You could have a lower VQ and you could have a higher VQ ratio, and that can give you this phenomena called ventilation perfusion mismatch, okay? And we'll talk about too with these different diagrams in a more detail about what that all means too, okay? Now let's talk about a little more in detail about, and this is just like, normal thing I'm talking about here right now, okay? Now, anything that's a ratio that's equal to like, okay, if the VQ is like, okay, the ratio is 1 and 1, or it's equal to 0.80, that means we call them as like, okay, that's normal, right? But whenever there's a high VQ, or there's a low VQ, there's some things that could change it, okay, that you could see. And the reason why this we have studied, because this can help us to determine determine whether patients are like, hypoxemia or not, okay? So that's usually, it helps us to determine that, and we'll talk about this too, okay? Now, as we go further, let's go and talk about a little more detail in here. So let's hear this. If I'm back here, this is one diagram that I drew here, okay? So here, let's just talk a couple of things. So first things you have to talk about is, okay, let's use this concept, a high VQ, and we'll make in here. So normally, what is the what is my partial pressure of like carbon dioxide on my artery side here? Usually my partial pressure of oxygen is what? The mixed venous side, okay? We'll have to write, okay, let's just write a mixed venous side, okay? Because so we write down like, okay, here mixed venous side, my carbon dioxide level is what? About 45 millimeters of mercury, right? And then you have to use the units, okay? And then here, what is the pressure here? That is going to be oxygen here. That's going to be what? About 40 millimeters of mercury, right? In this, what it is coming here. Now, we have to know that what is the partial pressure of oxygen inspired air, okay? We have to know that. Let's just write down here. Partial pressures of inspired oxygen. And do you guys know how do you find the partial pressure of inspired air? Usually what you do is like, what is the partial pressures of, what is your barometric pressure? That's what you have to know, right? The barometric pressure is about what? The barometric pressure is about what? 760 millimeters of mercury, right? That's what you get. All right. Now, if you want to find out what is the alveolar pressure, what you do is like, okay, let's just write down here. If you want to find out what is my alveolar oxygen content, is that you need to know, okay, what is my partial pressure of inspired O2, okay? I need to know that, okay? Then I need to, because it goes to the conducting zones, right? And remember, whenever you go to conducting zone, there's already air, okay? And what it does is that it exerts, there's some water vapors and other molecules, right? And they exert like about 47 centimeters of water, right? And then you just do that times, okay, it's going to be minus, what is my partial pressures of carbon dioxide in my arterial and alveolar right here, and you do R. And what is R? You're basically finding a ratio, this ratio, ventilation and perfusion ratio, which is going to be 0.80, right? 0.80. In that case, look, usually in order to find this one, okay, the partial pressures of inspired O2, we always say that it's a 21% of the barometric pressure, which is like 760 millimeters of mercury. So if you do 21% of 760 millimeters of mercury, what should you get? You should be able to get, okay, 0.21, right? 21 times 760. You should be able to get like 159.6, something like that, right? Okay, 0.6. You do minus 47, right? And then this PA also, you do what? Usually it's a 40 millimeters of mercury over 0.8, right? So in that case, if you do, all right? So in that case, okay, hold on, 21, 0.21 times, okay, 760 minus 47, what is that going to give me? 760 minus 47, that's going to give me 713, right? So 0.21 times 713. That's going to give me 149. So this is going to be, because you have to do 760 minus, because this is 760 minus 713, and you do 0.21%, 0.21% of that, and that should be able to give me like about 150. Okay, and then you should do 140 for 0.80, and when you do this, 80, 40, that should be able to give me 50. So now, I should have like a partial pressures of alveolar O2 should be 100 millimeters of mercury. Right? That's how you get that. So now, if this is my, let's say here, about, okay, 150 millimeters of mercury, something like that. Alright? When it gets here, this is going to be what? Here, it's about what? Right here, is going to be 150, and if you know the partial pressure of carbon dioxide right here on the alveolar, that's going to equal to like about 40 millimeters of mercury, right? Now this is what usually happens. Now, if you use this, okay, if you use these equations, which means that there's a higher VQ, okay, which basically means in the OPEX, there's more ventilation, but there's less perfusion. That means less blood is moving there. If it's a less blood is there, but there's more air is there, then what is going to be happen? So if there's going to be more air and there's a less blood is going to be here, then what's going to happen? Some of the air will get wasted, right? Because of the blood. So because your air is going to get wasted, that means the wasted air we call dead space, right? And then there's going to be what? The higher, some of the air is going to waste it. So because of what happens, these guys with the higher VQ guys right here, let's just say higher VQ, what is usually my oxygen level would be there. Usually my oxygen would be, let's just write down the oxygen, partial pressure of oxygen would be about they'll be higher, right? It will be greater. Okay, greater. And what about my parts per carbon dioxide? That's going to be lower. Right? It makes sense, right? Because if normally it should be look like that, right? Normally it should be look like that. But what happens is that because there's lots of air there, but there's less blood. That means less carbon dioxide is going there. And then there's more air is there, right? So maybe the carbon dioxide level is here probably. What's going to happen is probably like 28 or something. And then because of what happens, this instead of 40, it should be 40 ideally. Okay, but it's 28 or 29, and in that case, when it mixes with this, the air, it will become maybe, let's say, 130 milliliters of mercury. That's what you get to see in high VQ. Okay, this is examples of this is the pressures that you get to see in high VQ. Okay, whenever you high VQ, whenever you have VQ that's greater than 0.80, 0.10. Okay, now that's what you get to see. Now, and you know the normal, right? Now, if this is the high VQ, let's talk about what do you get to see in low VQ then? What is low VQ means? Which low VQ basically means is that you have ventilations, okay, but you have a lot more perfusions, okay? In that lot more perfusion, that means what happens is that, okay, some of the blood is going to get wasted here, right? And normally, as you said, you are going to have 100 milliliters of mercury. Carbon dioxide is going to be here normally, right? But because, look, then here, okay, let's just write down here, the parts per oxygen I should be writing down here, which is going to be like this one, and this is going to be this one, okay? Now, and then this is going to be less, and then oxygen is going to be more down here. O2, and then this is going to be carbon dioxide, right? Now, in that case, what is going to happen again here? Okay, this is going to be, the positive pressure is going to be what? Here it should be, inspired should be 150, right? That should be getting there. And then should be 40 here for the carbon dioxide, right? CO2 here and oxygen here, right? Now here, again, the carbon dioxide should be going down here and the oxygen should be going down here, right? Here's the normal shot. But if you have, okay, ventilations that is less than, okay, VQ ratio is less than 0.80, okay, in that case, in the base, that means what is basically with the low VQ, what is happening is the ventilation is underfilled, and then perfusion is overfilled. You could say, like overperfused, you could say that, right? So if it's overperfused, that means what is going to be if I have a less air, that means obviously I'm going to have some of the blood is going to get wasted, right? So what does blood usually contain? Carbon dioxide, right? So in that case, what happens is that my partial pressure is oxygen. What is going to happen? That is going to go down, right? Correct? Because the air is low because it's less ventilation. But what about the perfusions? My carbon dioxide is going to be higher. That's what happens. So usually, if you want to be an exact number, because some of the blood got wasted because they were carrying carbon dioxide, so maybe it goes to, like, let's say 42 millimeters of mercury. Okay? And then maybe oxygen, some of the, because there's less air down here, okay, less air, so probably the possible oxygen would be like 88 or 90 millimeters of mercury. Okay, that's what you get to see in the low VQ. Okay? But remember, okay, this is, and this can relatively happen in your lungs normally too, okay, normally, and that can, the reason why we have to study VQ mismatch, as I said, it can tell us about the hypoxemia, okay, it can help us too, and I'm going with this numbers how you can actually determine, and these are, we call this as a VQ mismatch. You could have a higher or lower VQ, and we have to talk about carbon dioxide or oxygen level, okay, partial pressures of carbon dioxide, oxygen, and carbon dioxide level, right? Now, we talk about normals, and we talk about higher and lower VQ, right? Now, once we talk about the higher and lower VQ mismatch, we also have to talk about some of the other concepts, and that concept is what? That concept is where we talk about, okay, we need to talk about shunt. What is shunt means and what is wasted air means, okay? Let's say somehow I have embolus right here, right? I have embolus, and then in the embolus, what is going to happen is, okay, if I have embolus right here, okay, and then what it is that this venous side, okay, what is usually bringing here? Again, we have to talk about this. Usually it's bringing right here, let's just write it. Usually it's bringing my partial pressures of oxygen right here onto my venous side right here, okay? That is bringing my 40 millimeters of mercury. normally, right? And again, here venous side, positive pressure of carbon dioxide is about 45 millimeters of mercury. That is where it's coming. But let's say I have obstruction down here, okay, because of embolus, okay. If I have obstruction right down here, look. If I have obstruction right here, okay. If I have obstruction right here, then what's going to happen? That means the blood is not moving down here. It's a big obstruction here, right? In that case, what is happening here? We have to know this, okay? In that case, we have to know a couple of things. Look, if there's no exchange of carbon dioxide happening here, okay, usually carbon dioxide comes in and oxygen comes in right here, right? There's no blood is passing. There's no blood. There's perfused. This blood is what? There's no blood is passing through, right? So if my blood is not passing through here, then what is going to happen here is that, okay, damn, we have to think about it this way. That means usually what is my inspired air? Okay, 150 millimeters of mercury, right? That is my oxygen level, right? Of my inspired air. So if this is my inspired air, but if there is no carbon dioxide, right? If there's no carbon dioxide, if his carbon dioxide is not there, then remember our equations, we have to know the inspired air minus, right? Minus that, we have to think about that. Remember, 47 millimeters, let's forget about that. And we'll just think about P, your alveolar CO2 over your R, right? And to find the positive alveolar O2. Look, this air, 150 millimeters mercury, right? That is, what is going to happen is that is going to mix with the alveolar CO2. And because of that, what happens is the alveolar CO2 comes down to 100 millimeters of mercury, right? But if there is a complete blockage here, then there will be no exchange of this, okay? This is done. So whatever my alveolar PaO2 is, 150 millimeters of mercury is going to be there. So that tells me that this air right here, my partial pressure of oxygen is going to be 150 millimeters of mercury, right? Right here, 100 partial pressure of oxygen is going to be my alveolar O2 is going to be 150. That's going to be 150 millimeters of mercury, right? Which means that this much of air is going to get what? This is going to get what? It's going to get wasted, right? So that means whatever I inspired, that is going to match with the partial pressures of my arterial oxygen. That's what is going to happen now, because it didn't perfuse at all, right? So whatever, I mean, the alveolar oxygen level is going to be exactly the same as the inspired oxygen level. In that case, look, we do VQ, right? If we do a VQ, remember, what is my ventilation right here? Okay, in my ventilation, we basically say, okay, right here, my ventilation is 150, right? But then, my perfusion blood is is 0. So in that case, what happens? We get the VQ is 150 divided by 0. We cannot do that, so we call them as infinity. So VQ is infinity, or it's a dead space, we say, okay? Or wasted air. Or this is a complete wasted air. Okay, because it is equivalent to your inspired air. Okay? Now, this phenomena is called dead space. Now, let's say, somehow, we have a collapsed alveoli, or let's say collapsed alveoli. So this part of this, maybe there are other alveoli too, but this part is completely obstructed now. Here, let's make this as completely obstructed. That means if this part is completely obstructed, what is going to happen? What is my inspired? It's 150 millimeters of mercury, right? This is my inspired O2. If this guy is not coming here, then what's going to happen is going to have a 0 ventilation right here, right? I have a 0 ventilation here. And then what is going to happen here? My oxygen level is on the venous side, it's 40. And then my venous carbon dioxide level is 45. Is that going to have gas exchange? No gas exchange occurring, right? So my VQ is going to be what? My ventilation is my 0. My perfusion is going to be what? The blood is, whatever this blood is here, it's going to be exactly same down here, right? My alveolar O2 is going to be 40, and my alveolar carbon dioxide is going to be 45. So it is going to match the mixed venous blood, right? So whatever my venous blood was, it's going to be exactly the same on the arterial side too. So this is called mixed venous blood. So what happened to the blood? It just went to the arterial side, right? Without getting gas exchange. And my ventilation perfusion is equal to 0. And we call this phenomena, whenever there is your venous blood is going to the arterial side without gas exchange and is exactly same composition or same partial pressure, we call them as a shunting. A shunting happened there, okay? This VQ is 0 because the perfusion is like, okay, let's say that's a 5 liters per minute, right? So this is 0. So this is called shunting. Okay? Now this is the blood shunt from there. Okay? Now, a couple of things that I have to make it clear is that you don't want to get confused with the dead space shunting dead space with the VQ mismatch or higher V or lower VQ. The reason why is, remember, let's graphically, if I made this graph down here too, and we'll talk about graphically, we'll talk about this too. Okay, basically, right, if you come here, right here, okay, and if we let's put all this graph down here, okay, look, whenever this is, look, in here, this is the carbon dioxide here, 20, 40, 60 right here, right, and this oxygen millimeter marker graph, you probably have seen this sort of graph, right? What happens is like, whenever my, okay, partial pressure of oxygen is 40, right, and then, right here, right, this out, and then here, what is going to happen is this is going to be my, what is this, the partial pressures of oxygen, this is like about 45 right here, this is my carbon dioxide level, right? Whenever partial pressure of oxygen is 40, and my partial pressure carbon dioxide level is, let's say, 45 right here, okay? In this position, what is happening down here? If you look at the graph, do you see where the partial pressure of oxygens is exactly same as the arterial side? You see that in where? You see that is on right here. Partial pressure oxygen arterial side 40, 45. A carbon dioxide 40. That means this basically, you can say this is a VQ word. Whenever there is a 0, shunting is there, right? This tells you that. Now, if I look at this graph, other one, and if we look at that, okay, we'll look at the arterial side. In the arterial side, I have a partial pressure oxygen is 40, but I have a, let's say, carbon dioxide level is going to be 150 millimeters of mercury. So that means, I have a 0 actually. Carbon dioxide level is 0, like in this case. I have a 0 here, right? 0, but then my oxygen level is 150. Where do you see that? Like right here, this is 150 right here. In this case, whatever the inspired is aggressive. And this says VQ is when is equal to R infinity. Or there's a dead space, right? Because it's got wasted. Now that's what it says. Now, what is my normal? Normal is my partial pressure oxygen is 100, but it should be that, right? Usually my partial pressure oxygen should be, okay, if I make this my, like Venus right here, okay, what happens is my normal is, okay, here should be, alveolar O2 should be 100, and then CO2 should be 40, right? And then if Venus should be what? On the Venus side, O2 should be 40, and then CO2 should be 45, right? And then oxygen side, it should be what? alveolar O2 should be 100, and then PaCO2 should be 40, right? So this is what I should have. So my oxygen level is here 100, and I should have partial pressure 40 right here. So this is my what? This is going to be my normal, right? And this is my dead space right now. We'll talk about the VQ mismatch. Whenever you higher VQ and lower VQ, if you look at the higher the VQ, what you have, what is? Because VQ has to happen between these two. Between the dead space and then shunting, the VQ mismatch happens, okay? So if you look at this, if my arterial side, what is this arterial side? I have oxygen level that is high, but carbon dioxide is low. So I have to find out somehow, my oxygen level is high, like maybe down here, let's say 130 down here, but my carbon dioxide is probably like down here, about like 20. This point right here, we'll have a higher VQ, okay? And then if you have a low VQ, this graph right here, if we say this, then we can say this lower VQs, what do I have? I have a low oxygen, okay, maybe like down here, like 88 or something, like down here, and I have a higher what? Oxygen, right? Higher carbon dioxide, so maybe like down here. So this point right here is going to be what? So it'd be lower VQ. Now, these are very, very important concepts, guys. Like, you have to understand this really well, right? Now, this is graphically, you can see this too. And if I want to make like a diagram, like for example, this point right here, this one represent me, like right here, this graph, right, if you want to represent, okay, let's just make this, a little differently right here. Okay, let's just write down the VQ here, and then VQ right here, okay? This is why this VQ, okay, whenever I have the VQ is higher, this is represented by this point right here, okay? And then if you want to represent this one, this is my normal right here. Okay, this normal is represented by this normal point right here, okay? And then if you want to make another color VQ, and this graph is like low VQ is represented by this one right here, right? And then if you want to do we don't have the VQ shunting, but it could be here too in the upper floor. There's like shunting happens if no flow happen. If exactly no flow, then we can represent this graph right here. What is this? The part, this one is by right here, this point right here, and that graph is representing this VQ shunting. Okay. Now we talk about VQ mismatching. We talk about shunting. Just want to check if I'm missing anything. Okay, high VQ shunting. We talk about that. VQ ratio. We'll talk about that too. Right. Just want to make sure that I didn't miss anything. Okay. Now after this, let me just quickly talk about why VQ, the low VQ and high VQ, they're different. The reason why is because what is different from shunting versus the VQ mismatch is, look guys, if I make let me erase this and we'll talk about this. Okay, what happens is, let's make 2 alveoli right here, okay? And we'll make this 2 alveoli right here. And we'll make a 2 right here, okay? And what happens is that, okay, if I make a 2 alveoli right here, okay, and really what happens is, let's say this distal part of alveoli, this is not working, okay? Okay? This is just not working. This is not participant gas exchange. But other area right here, this is participant gas exchange. Okay, if this is participant gas exchange, there's some of the air did get participating, like this air, like down here, this did get participant gas exchange, right? Because of what happened, this is the air that did not get accelerated. That means some of the blood is going to get wasted here, right? So if some of the blood is going to get wasted, if that's the case happen, then that's going to give me a low VQ. You see what I mean? Now, let's make this alveoli right here. Okay, and then what happens is that, okay, let's say there's some kind of obstruction around here, okay? That means less blood flow is going down here, but there's still not complete blood flow, okay? And there some of the air got wasted here, okay? Some of the air got wasted here because there was some let's say thrombi or something. There's a little disturbance of the flow. That means some of the air got wasted, right? And then because some of the air got wasted, it's going to create dead space. That's going to create some high VQ. If you look at pathologically, if you want to look at it, that's how I have to look at it. That's why you get to see the VQ mismatch. So it's different from the shunt, okay? The VQ mismatches.